Before you continue watching, take a look at your hands. Look closely at your fingernails. Not because your nails tell you exactly what is happening inside your heart, but because they may be showing small clues about your circulation that many people over 60 never notice.
Your body is constantly sending signals. The problem is that most of us were never taught how to recognize them. Many older adults wait until they experience chest pain, extreme fatigue, or a serious health event before they pay attention to their cardiovascular health. But sometimes, subtle changes appear much earlier, and one of the places where those changes may become visible is right at the end of your fingers. Today, we are going to look at several nail changes that doctors pay attention to during medical examinations, what they may be connected with, and when it is worth mentioning them to your healthcare provider. If you are over 60, or if someone you love is over 60, stay until the end because the last signs are among the easiest to check at home. As we age, our cardiovascular system naturally changes. The heart, blood vessels, and circulation system have worked for decades, and after the age of 60, maintaining good circulation becomes even more important. Your nails grow from an area called the nail matrix, located underneath the skin near the base of your nail. This area receives blood supply through tiny blood vessels. Because nails depend on healthy circulation to grow and maintain their normal appearance, certain changes in color, texture, or growth patterns can sometimes provide clues that something in the body deserves attention. But remember this, your fingernails are not a diagnosis. A nail change does not automatically mean you have heart disease. Many nail changes can come from normal aging, injuries, nutritional issues, medications, or other health conditions. The goal is not to create fear. The goal is awareness. Knowing what to look for can help you have better conversations with your doctor. One nail change doctors sometimes recognize is called Terry's nails. This appearance happens when most of the nail looks pale or whitish, while a narrow area near the tip keeps a pink or reddish color. For some people, this can simply be related to aging, but in certain cases, it may be associated with conditions affecting circulation, the liver, diabetes, or the cardiovascular system. If you notice pale nails, don't panic. Ask yourself, has this change appeared recently? Is it happening on several nails? Are there other symptoms such as unusual tiredness, swelling, shortness of breath, or changes in your overall health? A single nail appearance cannot tell the whole story, but it can be a reason to ask questions. Another pattern doctors may observe is known as half and half nails, sometimes called Lindsay's nails. This happens when the nail appears divided into two different areas. The lower part near the cuticle may look lighter, while the upper part toward the tip may appear darker or reddish-brown. This type of nail change has been observed in people with certain chronic health conditions. For older adults, the key message is simple. A noticeable change in your nails that develops over time should not be ignored. Your nails are part of your overall health picture. They can sometimes reflect changes happening elsewhere in your body. Have you ever noticed white lines crossing your fingernails? Some people see these lines and assume they are just a cosmetic issue. But certain types of horizontal nail lines, sometimes called Mises lines, can appear after the body experiences significant stress. They may follow serious illness, infections, major physical stress, or certain medical treatments. Fingernails grow slowly, so a visible line may represent something that happened weeks or months earlier. If you notice several unusual lines appearing without an obvious explanation, discuss it with your healthcare provider. Another pattern to watch for is called Bowes lines. Unlike white lines, these appear as actual grooves or dents across the nail. They happen when nail growth temporarily slows because the body has gone through a significant stress event, serious infections, major surgery, severe illness, or physical trauma. For older adults, these grooves can help explain something that happened in the past. They do not necessarily mean something dangerous now, but they can remind you to think about recent health events. Now look underneath your nails. Do you notice tiny dark lines that look almost like small splinters? These are called splinter hemorrhages. Sometimes they happen because of a simple injury, a forgotten knock or pinch. In many cases, they are harmless. However, when multiple unexplained dark lines appear under several nails, doctors may investigate further. In some situations, these changes can be associated with problems involving the blood vessels or the heart, including certain infections affecting the heart valves. Ask yourself, did these marks appear after an injury? Are they only on one nail, or are they appearing on several nails without a clear reason? Small details matter. If something unusual keeps appearing, it deserves attention. At the bottom of your nails, you may notice a small white half-moon shape called the lunula. Many people never think about it. Some naturally have very visible lunulae, others barely see them. That alone does not mean something is wrong. However, sudden changes, unusual colors, or changes happening together with symptoms like increased tiredness, shortness of breath, dizziness, swelling in the legs, or reduced ability to do normal activities may be worth discussing with your doctor. Script 15. Your nails are only one small piece of the puzzle. The full picture includes your symptoms, medical history, lifestyle, and health checks. A simple observation you can do at home is the capillary refill test. This does not replace a medical exam. It is simply a way to observe how quickly color returns after pressure. Make sure your hands are warm. Hold your hand around the level of your heart. Press gently on your fingernail until the nail becomes lighter, then release. Watch how quickly the normal color returns. For many healthy people, the color comes back quickly. If you consistently notice a very slow return of color, especially with other symptoms like cold hands, weakness, dizziness, or circulation problems, mention it to your healthcare professional. One observation does not diagnose a condition, it gives you more information. Many people think aging means they should simply accept every change in their body, but that mindset can cause problems. Getting older does not mean ignoring warning signals. After 60, prevention becomes one of the most powerful tools you have. Regular checkups, controlling blood pressure, staying active, eating well, sleeping enough, and paying attention to changes in your body can all support healthier aging. If you notice something unusual in your nails, follow these steps. Take a clear picture in natural light so you can compare changes over time. Check whether the change appears on one nail or several nails. Think about when you first noticed it. Did it follow an illness, an injury, a medication change, or a stressful period? And finally, discuss it with your healthcare provider, especially if the nail changes are new, worsening, or happening together with other symptoms. A good doctor looks at the entire picture, not one sign alone. Your hands have been with you your entire life. They have helped you work, create memories, and take care of the people you love. Sometimes they can provide small clues about what is happening inside your body. Your fingernails cannot predict the future, and they cannot tell you whether you will have a heart problem. But they can remind you to pay attention, to ask questions, and to take your health seriously. So tonight, take a moment, look at your hands, notice the changes, take care of your circulation, keep your medical appointments, never ignore changes that feel unusual. Healthy aging is not about adding more years to life. It is about protecting the quality of those years. If you found this information helpful, share it with someone over 60 who cares about their health. A simple reminder can encourage someone to take better care of themselves.